Well, my experience with the healthcare system has been mixed. The experience that I had involved my mother. She's 88 now, quite frail. Got a number of problems. Health problems started when she was about 60. 3 years ago, when she was 85, a blood count dropped to a level that the doctor became really concerned about. Up till that point, she'd been taking iron tablets and B12 injections. Made her feel better, and that worked fine. That was okay. Got to a stage just over 3 years ago where she was likely to need a blood transfusion. She wasn't keen on going into hospital, but eventually she developed angina because of the low blood count. We had to phone for an ambulance, took her into local hospital. Going through A&E wasn't a good experience. Each visit was at least 3 hours in A&E. Probably an average of about 6, for a number of different reasons, often waiting for bed space so she could go up and have a transfusion. But each visit into A&E also, it was like a new visit every time. And after 20 or 30 visits there, being asked the same questions as though she'd never been in before, it was very frustrating. The community team, the nurses who came out to me mum to take her blood, communicated very well. We knew exactly what was going on, and they made me mum feel as though she was a person and not just another patient. Teams on the ward were great, and nursing staff in most places, if not all, were very good. I think the NHS could improve by looking into all the old records on patients that they've got.
The advantage of clinical commissioning is that you're bringing clinicians such as myself into a process of designing services for your population, but keeping your feet very much on the ground because you're obviously dealing with patients every day. In terms of our priorities, we base our priorities in two main ways. The local authority and the local health service work together to develop a health and wellbeing strategy, and this identifies the key areas that we in the borough wish to invest extra effort in and extra money in to try and drive up standards, and there are 8 of those, and one of those, for example, would be to improve the urgent care pathway and reduce readmissions to hospital for people, particularly the frail elderly. From a CCG point of view, we've got a series of 8 priorities as well, which are identified by our members but also by the NHS nationally. So between those two things, the health and wellbeing strategy and the clinical commissioning strategy, that really gives us our priorities that we deal with over the year. We've developed a 3-year strategy for managing those.
St Helens CCG has 5 GP board members. We are in touch all the time with fellow members, so in fact there's a lot of doctor-to-doctor communication. The vision of St Helens CCG is to provide quality, safe, effective, value for money healthcare. Never a day goes by without us analysing either a care pathway or the quality of service or the value of the service. So we spend an awful lot of time improving the health services in general.
I think the shift towards clinical commissioning is a good thing because for a long time it's always been said that really people who make decisions about services that local patients should be receiving should actually have daily contact with patients and be able to actually sort of hear feedback about patient experiences. We have a very clear sort of vision of trying to deliver the right care for people at the right time in the right place. I mean, one of the things that I'm particularly excited about within all of that is that not only the CCG but the local authority, the public health colleagues and patients recognise that dealing with people with long-term conditions is going to be quite important as we go forward. So I think that if you put together the sort of clinical experience on the CCG board, backed by the very capable and strong team of management we've got, in addition to our contacts and collaboration with partners, and I think we're very well placed to address the things that really matter for the people of St Helens.
I think clinical commissioning will be good for patients because it puts patients at the heart of decision making. For the first time, patients will have been involved in shaping how their journey through the healthcare system is managed. This should result in a more patient-centred healthcare system, which one would expect ultimately to lead to improvements in the health and well-being of our patients.
I'm Sarah Johnson, I'm Head of Clinical Commissioning and Service Improvement, and my job really is to kind of operationalise the CCG for St Helens. I believe that clinical commissioning is a really good thing for St Helens patients because it puts the GPs who see patients day in, day out at the forefront of decision making. And what that means is if a patient has been to see their GP on a day and has a particular issue or has had a good experience or a bad experience, we can translate that right up through the organisation, and that actual conversation can influence our decision in how we design services. St Helens CCG is really in touch with the clinicians and the doctors and the nurses and the patients on the ground, and that's because we're a membership organisation, and what that means is every single GP practice across St Helens is a member of the organisation and therefore influences the direction and therefore then influences the services that we commission on behalf of our population. It's about making sure that we provide services that are right for our patients but really embedding care and dignity into everything that we do.
The way that the CCG will be different from its predecessor is that it's much closer to the community and it engages with all the partners who deliver health services to the community of St Helens, including the local hospitals, the local authority, the voluntary sector, the housing associations and the private sectors, which should reap real benefits for patients. Personally, I see it as a real challenge and one which is really exciting. We have a very talented, enthusiastic team. We have an excellent clinicians led by Steve Cox, who is a very able leader, and we see it as a real opportunity to improve the health and well-being of the people of St Helens.